What we're going to be doing now is the active isolated stretching, the PNF, for the quadriceps. What we're going to do is discuss some of the contraindicated stretches that we do not want to put the lumbar spine into too much extension here. So we're going to have our client lie prone, please. Now, what I see from a lot of healthcare professionals, including personal trainers and the like, is that what they do is they come in here and then they brace here and then they pull this up. What that does, it puts a tremendous amount of stress on the lumbar spine. If there's any other underlying pathologies, we kind of don't want to do that. So there's better alternatives, in my opinion, than kind of coming in here and trying to brace this down and pulling this up. So we're going to have our client lie on their side, and what we're going to do is we're going to bend that bottom knee up. When we bend the bottom knee up, it pulls the pelvis this way and takes pressure off the lumbar spine. Makes perfect sense. We're going to do two stretches. Since the quadriceps cross two joints, they cross the hip, they cross the knee, we want to stretch the proximal side first. So what we're going to do is I'm going to place my hip on the client's hip here. The client is holding the leg up. I'm going to hold by the ankle and hold by the knee. My hip is bracing now with the person's knee, and we're going to come back. We don't want this riding up too high. So like almost like a basketball pivot, if that makes sense, basketball pivot. So now their hips are stable. Contract, relax. We're going to push forward. 3, 4, 5. Pull back. So that will stretch the proximal end. So here we go. Push forward. 3, 4, 5. Relax. Proximal end. Now we want to work the distal end. I call this one walking the gait. So what we're going to do is we're going to have the client with their greater trochanter lined up with their lateral part of their knee completely straight. You're going to brace the knee. They're going to feel it more distal. Put your hip in so you don't have to really hold. Keep this completely straight. You're going to bend the knee to their comfort. They're going to push towards us. 3, 4, 5. Stretch the quadricep. Okay? So we want to keep this leg straight, completely straight, not too high again. Here, bend the knee to their comfort, hardly have to hold. They push this way, relax, and we stretch. So let's try this on the other side real quick. So you can flip over. Okay, so she's holding this leg up. That way, turns her pelvis, takes pressure off the back. Great job. We're going to come here. I'm going to put my hip. We're going to stretch this region here now. Come this way. She's going to push forward. Relax. Stretch. And then we're going to come here. This stays in completely straight line. I'm going to hold the knee and keep it in place. And bend the knee. I call it walking the gait. She pushes forward towards me. Relax. Okay, line her back. So since the quadriceps cross two joints, we want to stretch the proximal end and distal end. I prefer not doing this